Welcome back to the What About Mom podcast, where we go beyond surface level advice and into the real, raw, and radical work of healing, evolving, and reclaiming your identity as a woman and a mother. I'm your host, Jessica London, doctor of physical therapy, pelvic floor specialist, mom to two, and founder of Your Postpartum PT and Wellness. This show is your space for bold conversations, practical tools, and powerful reminders that when mothers heal, so does the world. So whether you're rebuilding your strength, finding your voice, or rising into the woman and mother you're becoming, you are in the right place. Let's dive in. Welcome back, moms, to the What About Mom podcast. It's your host, Jessica. I have Hannah Gill on today. She is a doula, a childbirth educator, specifically focusing in on mothers that are looking to have a VBAC. So cool, so near and dear to my heart, because obviously, if you know my journey, my story, I had a VBAC with my second kiddo at home. But Hannah really specializes in helping moms prepare for successful VBACs with confidence, helping them navigate birth choices and advocating for their needs and desires, and really helping them build a strong support system for a specific birth outcome that they might be hoping for. And also really helping them develop like a deeper understanding of their bodies, the birth process, and how to let go of fear and increase trust and intuition in the birth process. So excited to have you on. I think this is such a needed and important topic for mothers as they are considering their birth choices, whether they have a repeat cesarean or whether they are aiming for a VBAC. But welcome on.
Thank you so much for having me. I'm very excited to be here. Obviously, VBAC is a topic that I could talk about all day. So I'm very thankful to be here.
Yes, cool. I'm so excited too. Okay, so let's just start with the basics. What does VBAC stand for? I think a lot of people hear that and then they're like, what does that even mean? Or sometimes people hear HBAC and they're like, what is that? So if you want to just briefly go over what is a VBAC and maybe also who would be a good candidate for considering this possibility.
Yeah, so a VBAC is a vaginal birth after C-section or after cesarean. Sometimes you might also hear TOLAC, which is a trial of labor after cesarean, which is more of the medical term. And then they would call it a VBAC after it already happened. So the actual labor part is a TOLAC. VBAC would be after it happens. HBAC is a home birth after cesarean. DBAC is a cesarean birth after cesarean. There's so many different acronyms and terminology to go into, but that's a general overview of vaginal birth after cesarean.
Okay, that makes perfect sense. So thank you for clearing all of that up. I'm sure there's a million more acronyms we could probably continue to go down. But basically, you've had a cesarean birth and now you're pregnant with your second kiddo and you're considering what type of birth method am I hoping for, planning for, desiring for, and also what am I good candidate for in all of those processes too. How would somebody know if they are a good candidate for a VBAC?
Yeah, so years ago, it was always if you had a C-section, you're going to have a C-section again. And I feel like I'm so close to it, and a lot of other people are so close to it, that they just assume everyone knows that you can have a VBAC. The amount of people I talk to that don't even know what a VBAC is still, and they've had multiple C-sections and were never discussed VBAC, is alarming to me. But really, if you're a good candidate or not, quote unquote candidate, it's kind of going to depend on where you live, where you are, your personal history. There's a lot of things that go into it. But if you're going by ACOG standards, which a lot of people do, the majority of people are going to be birthing in the hospital. It would be if you've had 1 or 2 prior C-sections with a low transverse incision. So that's an incision that's low on the uterus and horizontal, not vertical. If you don't have any other major complications or issues like a placenta previa or something like that, we could get very into details about that. But in general, if you've had 1 or 2 prior C-sections with a low transverse scar or incision on the uterus, but there are people that birth outside of those parameters. That's just based on ACOG standards.
Okay, and that's quite a big of the population too. Isn't that majority of C-section births prior, they do fall into that category, right?
Yeah. So about 80 to 90% of women who've had a C-section are going to be good candidates for a VBAC.
Yeah, and that's so incredible, to even hear out loud too, because you're totally right. My mom had 3 C-sections back to back to back, and it was once a C-section, always a C-section. So there really wasn't wasn't a whole lot of education for her even to even understand or know if that was a possibility for her. So I really feel like as generations and as like, more people are speaking out and sharing, it also is evolving that way too. Are you kind of noticing that trend too of more people, maybe in our generation, that are looking more towards potential VBAC?
Yeah, I think people are becoming more aware of it primarily because of social media. But also the thing that surprises me, even with social media, there's still people who have absolutely no idea. But when I feel like your algorithm is like churning out birth stuff because you're involved in that area, you think, oh, everyone knows this is a possibility, right? But definitely generational. Uh, Older generations consider like you're going to have a C-section again. Like I talked to my aunts and my grandma and stuff, and they were just like, "Oh, you're just gonna have another C-section, right?" And I think it's definitely a generational difference there.
Yeah, that definitely happened to me too. They're like, "What are you doing? Like, is that safe? Is that okay?" And I really had to like, if you're like listening to this and even considering it, you might have people in your circle that are a little confused or concerned for you. And so that's like really where we have to, do our research and build that resilience in ourselves and that trust within ourselves to make sure that we feel fully confident also going in that direction too, because there is still that like polarity, if you will. There are some that generations or healthcare providers or whatever it might be are gonna feel like that's an unsafe choice.
Yeah.
So even just to hear you say like ACOG standards, 80 to 90% of people are actually great candidates for this, like that statistic lands pretty strong as well. And I want to like throw it back a little bit. You got into this work specializing working with mothers that wanted to have a VBAC because you went through this process yourself, right?
Yes. So my first birth was an unplanned, very, very unplanned traumatic C-section for me. And I had never even heard of the term VBAC before. I just assumed everyone went on to have a vaginal birth. I never even heard like C-section, you must have another C-section. I just thought, oh, this is what I'm going to do. And then when I actually started researching it and found the term VBAC and realized like, oh, this is something people actually have to fight for and like struggle with getting support for. Okay, what's going to happen here? So after that birth, I became a childbirth educator because I felt like my birth class that I took did not prepare me for birth and like the potential for a C-section and different outcomes. So I did the childbirth education side first and then became a doula after my experience with my doula for my VBAC. So
Yeah, that's so true for me too. I mean, obviously, my birth was like a very unplanned, unexpected C-section. I was even trying for a home birth and then had multiple days in labor and ended up transferring to the hospital. But I think what's really important that you said here too is like the lack of education of preparedness for a vaginal birth and a C-section birth, right? I think a lot of people think, oh, I'm just going to have a vaginal birth. That's just the way it is. And we really don't prepare our minds to open the possibility of, well, what if a C-section happens? Like, how do I mentally prepare for that as well? And I'm sure, like, being close in that work with VBAC, you're also preparing clients for that too. If there is a chance that they could trial labor for a VBAC and not have, the birth method of a VBAC afterwards. So, do you find that that's challenging for clients to go down that path? And how do you help support moms to really build the mental resilience in that preparation phase?
oh, 100%. I feel like the majority of people that go into a VBAC they think, I'm gonna have this VBAC, there's no other option. I'm not even discussing the potential for a C-section. And that really comes more from like the trauma of that C-section, really playing into that. But I think it's so important, not to just, like, be super negative, like, "Oh, I'm gonna end up another C-section," but prepare for that possibility because my first birth was so traumatic for me because I was not even prepared that a C-section would be a possibility for me. It wasn't on my radar. I didn't know how to, take steps to prevent that from happening, or if it did happen, how to cope with that, how to heal from that. So I just thought C-sections are emergencies. It's not gonna happen to me. And I didn't know the stat of like 1 in 3 people get a C-section. So I think mentally and physically preparing that this is a possibility. If it does happen, how am I going to go through that process instead of just thinking this could never happen to me? I'm going to have this feedback because I see so many women say, like, I TOLACed, I tried for a VBAC and it didn't happen. I feel like I failed again. And the emotional impact is so great because they were not even prepared for the potential of a C-section to happen again.
This is so crucial that you're talking about this because I completely agree. A lot of birth trauma is actually like lack of preparedness or lack of awareness of like what could be the possible outcomes. Cause I felt the same exact way too, like having a very unexpected, did not even understand and consider 1 in 3 had a C-section. That's a pretty big statistic. Like 33% of people are going to end up having a C-section. Now, we could do a whole separate podcast on that statistic being really high as well and what we could be doing to prevent that. However, it is what it is. In the United States, like 1 in 3 are ending up with a C-section. So it is so important for us moms, whether you're a first-time mom or planning for a second, third, fourth birth, to really be empowered and educated, not only in the birth process, but like what are all of the possible outcomes and what does that mean for me if one of those things happens too.
And a side note about that statistic that most people may not know is the majority of that stat is repeat C-sections. So it's actually higher in repeat C-sections than it is primary C-sections. So if we increase the VBAC rate, decrease the repeat C-section rate, that rate can go down. And most people don't realize that. Yeah.
Oh my gosh, I don't think I even actually realized that too. So it's not primary. What you're saying by that, just to like be super clear, is it doesn't mean 1 in 3 first-time moms
Right.
are
1 in 3 in general. Yeah.
1 in 3 in general. So this is moms that are maybe not even considering a VBAC, or maybe the providers aren't educating or supporting in this capacity for the allowance or the recommendation or the encouragement, guidance, support that this mom needs to go for a VBAC. Right. Why do you think, and I'm totally okay if we get woo and go down the rabbit hole here, because like, me, and if you listen to this podcast enough, you kind of know that like I love the healthcare system. I absolutely love Western medicine, but I also feel like there's a huge missed piece, especially in birth, and really honoring and trusting the woman's body, the woman's intuition, the inner wisdom of our bodies. And as long as we're supported in that and nurtured and educated, our bodies can do incredible things. But I am curious to know from your perspective, being a doula, being in this work of childbirth education, why do you think there's so much fear of allowing women to be empowered to have a VBAC? Or why is it just like a recommendation that providers make, or they maybe say, oh, I'm, air quotes, VBAC friendly, but then when it really comes down to it, they're really not. And then it's like a pivot to C-section last minute. I would love to know your take on that, your experience with that, of why we might be stuck in that loop.
I think the fear truly all comes down to uterine rupture risk. And um, that's like the primary fear that people think about when they talk about VBAC is uterine rupture. The other fear is that if I go through this and end up in another C-section, like that's a fear as well. But as far as like provider support, uterine rupture risk is obviously the biggest thing that people discuss. And I think it's an issue with the actual medical practice catching up with like research, evidence, data, and all of that. So back in like the 90s was when there was like a huge VBAC increase, but they were also inducing VBACs with cytotech, which drastically increases the risk of uterine rupture. So there was like a ton of uterine ruptures because so many people were VBACing, but they were also being induced with dangerous induction methods. So then after that, it drastically decreased because everyone was rupturing because of all the induction. So there's a lot of still fear around that, and people think, oh, if you have a VBAC, your uterus will rupture and you or your baby could die. And like that's the language that is used. And it's like, that is scary. Like, I don't want to do that.
Absolutely. Yeah.
But then they don't really think about like, okay, well, are also risks to multiple repeat C-sections like placental issues, placenta accreta, placenta previa, hysterectomy, that are not discussed. And it's just assumed that, oh, a C-section is just safe. It's safer and it's not going to risk me or my baby. And there's not open communication about that. As far as like provider support, it all comes down to legalities and litigation and the fear of if this does happen, I could be sued, I could be held accountable. So it's not just like I support it or I don't. It comes down to the legalities of it and fear of their own job as well. So
Yeah. Yeah. And it also seems like maybe, C-sections are more controlled, right? It's
they
a more
are.
controlled environment where like
Yeah.
physiologically normal birth unraveling as it goes, it's not as controlled, and so there's more risk or there's more unknowns.
Mhm.
And I'm sure, like, kind of looping back to that legality piece or that fear piece is just like any human, right? We're humans practicing medicine. Maybe there's like an element of that humanness that is fearful of the physiological normal birth process and would rather have a more controlled environment, possibly in that birth process. You also brought up a really great point too of like understanding the risk factors of a VBAC, but also it's really important to understand the risk factors of multiple C sections too. And you highlighted it on it from like a surgical level, but too even from a level where we're working with moms, from a pelvic floor core rehab level as pre and postnatal fitness coaches and pelvic floor therapists. It's like repeat C section also does a huge toll on your body from a fascial integration level, from a core activation level, all kinds of hip, back, tailbone pains. Yeah, repeat C-sections also do carry risks in multiple areas as well. In addition to understanding and knowing the risks of a possible VBAC. What do you know the statistics like of what that uterine rupture risk is? Because from what I remember reading, it's very low, and maybe sometimes catastrophized as more scary than it really is.
Yeah, so with one previous C-section, again, with that low transverse incision, it's less than 1%. It's about like 0.5 to 1% without any induction. So if you're not inducing with Pitocin, and it's spontaneous labor, one previous C-section, that's the risk. Obviously, that will increase if you induce with Pitocin or if you've had more C-sections. There's some evidence on VBAC after 2 C-sections with uterine rupture risk. 3 or more C-sections with VBAC uterine rupture risk, there's not as much evidence, but there are women who have VBACs after multiple C-sections. But there are things you can do, like I said, to reduce that rupture risk. And the first is going to be not inducing if avoidable. And then having a little bit of a spacing between births. So usually 6 months is like the absolute minimum before conception. Some people do VBAC prior to that, but it does drastically reduce that risk if you wait at least 6 months. Some providers will tell you 18 months from birth to conception. Others will tell you 18 months from birth to birth, which brings up a whole nother issue of inconsistencies across the board between providers on supporting VBAC.
Yeah, I was just gonna say that, like, how confusing for a mom that's, like, trying to get the information, and one provider says this and another provider says this, and I'm assuming it's based off of them just reading different research and also their personal bias, I'm sure, as well.
Yeah, a lot of it has to do with what they've experienced, because some providers aren't even following ACOG guidelines, with supporting VBAC. Some have VBAC bans or they don't support VBAC after 2 C-sections when in most cases ACOG does. So there's just a lot of inconsistencies, not even just between states and things like that, but between providers in the same practice, which is very alarming. So
Oh my gosh, yeah, absolutely. So if we have mamas that are listening to this that are maybe preparing birth for the first time or maybe considering a VBAC, what would be like questions that they should be interviewing or asking, or how do they know like that they're going to find the right provider for them? And also like have Hannah on your team as your VBAC coach and your doula. No brainer, obviously, to have someone that's like very specialized in VBAC prep and can help you support that. But in general, from like how do they find their birth provider that will be most aligned with them? Like what kind of questions should they ask, or any tips or tricks you have on them finding the most aligned provider?
yeah, so the first step is going to be like deciding where you want to give birth. Do you want to give birth in a hospital, at a birth center, at home? And that's going to depend a lot on your state too. Like I live in Indiana and it's literally illegal. It's the law to have a VBAC in a birth center, like a freestanding birth center out of a hospital. You can have a home.
State?
Yeah, it's very by state. Like you can have a home birth HBAC, or you can VBAC in the hospital, but you can't at a freestanding birth center. Makes total sense, right? So check with your state laws first. And if you have issues finding that information, you can always like talk to your current provider. Or I always say like go to the doulas in the area because they're generally going to know like what providers are actually supportive. But once you actually find a provider or interview multiple providers, the first thing I always ask them or tell people to ask open-ended questions, not yes or no questions. So don't just ask, do you support VBAC? Because they're just going to say yes or no. They're not going to really give you an explanation on like their philosophy on VBAC. So I always say like ask, like, how do you feel about VBAC? What has your experience been supporting VBAC, and actually have them explain to you. The second would be like, how do you support VBAC patients differently than non-VBAC patients? And how do you handle interventions when it comes to VBACs? Um, you can even ask something as specific as, what are the specific policies and procedures in place for VBAC patients compared to non-VBAC patients? Because that's going to give you an idea of like how intervention happy they are, how many protocols and policies they have about VBAC versus not, and you'll get a feel for their actual language and how that provider personally feels about VBAC. Another thing is, if you are going to be interviewing multiple providers, in the same practice or within different practices, ask these same questions so you have like a consistent overview. And your your questions might be a little bit different based on like if it's like a home birth midwife versus an OBGYN. Obviously, they're going to be a lot different on how they support and how they practice. But get an idea of, based on the type of birth you want, the type of questions you want to ask. Because some people want to be back, but they want all the interventions. Some people want to be back, but they want to be like left alone. So make sure you're asking specific questions based on the birth experience you want and how they can support that.
Yeah, I hope you guys are all taking notes because those are really awesome questions, and I also love the idea of, like, asking the consistent questions between providers to see how they respond. Hey, quick thing while I have you here. If you are a postpartum mom who got cleared at 6 weeks but still feels totally unsure of what to do next, you are so not alone. We have helped over 650 pregnant and postpartum moms eliminate leakage, prolapse symptoms, diastasis, and pain with intimacy, all without having to leave their home, fighting the insurance system, or guessing their way through healing. Our one-on-one pelvic floor and core restore program combines expert pelvic floor rehab and strength coaching, giving you a clear, evidence-based, and customized plan designed for busy moms who literally don't have time to drive all around town, juggle childcare, or take more time off work. So if you're thinking, yes, I need this, just head to yourpostpartumpt.com/book call dash podcast to book a free inquiry call to learn more about what it looks like to work with us one-on-one and see if it could possibly be a good fit for you. Honestly, this could change everything, and most of our moms find full resolution in just 3 to 6 months working with us one-on-one. Okay, let's dive back in. I was interviewing my birth team, if you will, trying to have a VBAC at home. I felt like it was also really important too, and I'm sure you'll touch on this even deeper, but like, how does my body feel when I'm asking these questions and hearing their responses, and like really tapping into that intuition and that safety piece. Like, I think a woman's body will tell you, like, this makes me feel uncomfortable. I don't totally buy them. I feel like they might be lying to me, or like, oh my God, I feel so safe with this person. They fully believe in me. They're fully honoring me. Like, their answers are authentic. I think there's that element too, for me at least. I'm curious for you when you were preparing for your VBAC, if you were also like definitely going on the data and making sure that they, from a paper standpoint, were going to give you the best chance. But also, did you kind of tap into that as well for yourself when you were researching?
Did. And so I did something that the majority of people will tell you not to do. I interviewed multiple providers, but I stayed with the provider who did my C-section. And that is because I felt fully safe and I trusted her 100%. I knew that, like, with my C-section, she supported me and, like, having that be the last absolute option for me versus, like, going straight to a C-section. So, I interviewed multiple providers. I interviewed, a OBGYN who would do breech VBAC, just in case my baby ended up being breech. I interviewed home birth midwives. I interviewed hospital midwives. Um, and ultimately, I came back to my provider who did my C-section, which everyone's gonna tell you, "Don't do that." But I felt so safe in her hands and that she would support me no matter what. She didn't have any specifics, about like, "Oh, you have to induce by this date," or "You have to have an epidural," or blah, blah, blah. She supported anything I wanted, and made that decision up to me. So I stayed with her, and that could be your decision too, if you feel safest with your current provider.
Yeah, I think that safety word is so huge, especially when we're talking about birth. It's such a vulnerable process. It is such a process where we need to be held. We need to feel safe to be vulnerable. We need to be able to feel like safe in other people's hands because obviously, as you're going through that birth process, there's so many like unknowns and things that can happen and pop up. And so, just having a birth team that you feel safe with, your nervous system feels safe with, is so important. And I think that like really brings back the point of like, it really doesn't matter where you birth. Like, it's so important that women and moms like choose the best location for themselves and that they find the provider that makes them feel the most comfortable, the most safe. And that can be in various locations.
Yeah, I completely agree because a lot of people say like your best chances of VBAC are going to be out of hospital. And I mean, VBAC's out of hospital, the rate is higher. But if you don't feel safe out of hospital, don't choose that just because your first experience was bad or because someone else is telling you to, or if you feel safest at home and like you don't want to step foot in a hospital, do that. Like, you have to be safe, like, feel safe and comfortable in your environment, or your birth that tension's gonna hold in your body if you don't feel safe where you are.
Yeah, and considering just, like, having a C-section and then going for a VBAC, there's an element in that traumatic piece that you were talking about too, like, we both perceived this, like, this perspective that we had was that we had traumatic C-sections because it was very unknown, it was very unplanned. I don't know for you, I'm curious, like, was the trauma that you felt around that more based off of, like, the unknowns? Because it clearly wasn't based off of the provider because you felt safe in that provider's hands. It was more about, like, you weren't mentally prepared for that C-section. Would that be safe to say?
Yeah, so my trauma all stemmed from, like, the C-section on. Um, I did not feel like I was prepared at all on how to not only prevent that from happening to me, but the actual experience of a C-section and then the recovery afterwards. Um, and I look back on it now, I was like, I was not fully educated on what my options were, or that I could push in different positions with an epidural, or how to make a C-section a more calming experience. So it was definitely just the mental um, not being prepared mentally for that outcome was where the trauma came because I birthed with the same provider for my VBAC in the same hospital. I literally had the same nurse the first part of my labor on both times, and I had a wonderful experience, and, like, I absolutely loved it. So, it's not about just the location and the provider, it's about, like, how comfortable you are feeling in that moment and how prepared you are for those outcomes.
So we're talking about safety here, you guys, as safety in the provider, in the birth team, but also safety of the environment. Like doing what you feel is best for both of those to come together is extremely important and crucial to having a possible VBAC, successful VBAC. I hate the word like successful.
Yeah.
Like, do you have another word for me? But I feel like, but having a successful VBAC also it rings true.
I just say, like, having a VBAC, or having a repeat C-section. So I don't say, like, successful or unsuccessful. A lot of people use that term, like, "I had a failed VBAC." No, you had a repeat C-section or you had a
Really, I
VBAC.
love that. Yeah. Oh my gosh, so important. Okay, you also hit on ways that you can reduce your risk for C-section, and that goes into that like childbirth education piece that you and I both talked about of not really knowing all of our options and not really knowing how things could or couldn't unfold. So, if we have somebody here that is maybe a first-time mom or even a second-time mom trying to go for a VBAC instead of having a repeat cesarean, what are like real tactical things that they could be doing to try and reduce the risk of having a repeat C-section?
Yeah, so always tell people this, like, I specialize in VBAC, but how you prepare for a VBAC should be how everyone prepares for birth in general because the goal is a vaginal birth and preventing a C-section if possible. And that's not to say, like, well, C-sections are bad, everyone should prevent it. It's just if that is your goal, if you would like to have a vaginal birth, there are things you can do to, like, increase those chances. Um, the first is just decreasing the amount of intervention you have in any way possible. And I don't think people realize that people are interventions too. So who you choose to have in your birth space, that is like one of the first interventions to think about. So your provider, do you have a doula? Do you not have a doula? Who's going to be in your birth space supporting you? The second, like, as far as, like, actual interventions to your body, reducing those. So for me, especially, like, I wanted to be unmedicated. I wanted to avoid induction, because those things you can have a VBAC with those, but your chances drastically increase if you can, prevent those from happening or avoid those as long as possible. Another one for me was like a huge one, mainly for mental preparation, was avoiding cervical checks during pregnancy. I did not want any for my VBAC. I had them with my first, not with my second, because prior to labor, that means nothing, nothing at all. Like, unless you are preparing for a medically indicated induction and you need to know your Bishop score, don't get a cervical check, because everyone I see who does says, gosh, I'm only 1 centimeter and 50% of face. And then their mental state just plummets, and that does not help at all.
Nutritional value,
No.
right? Like, I think it just really messes with people's minds of like, "Oh my god, you're not further along, you're not," and then it's like, oh, we start talking about all these interventions
Yes.
after we
It
start
can be
taking cervical checks.
it's used against you, and it means absolutely nothing prior to labor. Some people don't even dilate until they're in labor. So that was one of the biggest things. It's just like avoiding those unnecessary interventions. And then if you are going to be getting interventions of some sort, like an epidural, um, be upright and mobile as long as you possibly can. Because a lot of times people will tell you, like, oh, your pelvis is too small to birth this baby, or this baby is too big. And it has less to do with pelvis or baby size and more to do with positioning of you and your baby. So being upright and mobile as long as you possibly can. And even with an epidural, know that you are able to be upright in those positions too.
Those are such good tips and tricks too, to really prepare for like your body physically, your birth team, your environment. What do you think about like their mindset? Because I know for me, I'm curious for you as well. Like it was such a prep of the mind, really going against maybe what some people thought was quote unquote acceptable or normal, like doing something that was very outside the norm. But also, I've heard this, and I don't know if it's true, but like someone told me when you are preparing for a VBAC, there will be at some point during your birth process that you will find like that mental block. And it tends to be around when you previously had to make that decision between like, vaginal birth and C-section birth. Have you noticed that consistently as well? And how do moms prepare for birth mentally?
Yes. So I feel like the biggest thing that comes up is like where the primary thing went wrong in the first birth. And for me, like specifically as an example, my first, I pushed for 4 hours before my C section. So I knew ahead of time pushing is going to be where I need to prepare myself the most mentally, not physically, mentally, because I knew like in that with my next birth, if I was having troubles pushing again, that I would have that panic there, that anxiety around pushing, like, I couldn't push this other baby out, now I can't push this baby out. A lot of women, it's with, like, "I didn't even dilate last time. I didn't even get to labor, like, my body can't do this." So, if they're getting cervical checks and they're not dilating, that mental process comes up. So the biggest thing I tell people is, yes, you can prepare your body, like, drink the tea, eat the dates, do the pelvic floor therapy, all that's important, like, that all helped me too, but heal and process your first birth first. Go through that process, like, the mental healing will bring on the physical healing. You really have to, like, understand what not just what happened during your birth, but how it made you feel through each state, and really processing where your biggest fears are coming up for your next birth.
Yeah, and I would say similarly for me as well. That's why I chose to not have cervical checks as well for my second process is it took me a really long time to dilate. I was in labor for 3 days and then I also pushed for like 3.5 hours. So one, eliminating cervical checks really eliminated this like, oh, you're at 4, you're at 3, you're at 6. Oh my gosh, you've been laboring for 6 hours and you haven't even progressed. And like there was so much defeat and doubt. So eliminating cervical checks just kind of allowed my body to do its thing. But there was a moment during the pushing phase for me too that brought up like self-doubt, like, oh my gosh, is my pelvis too small? Oh my gosh, is my baby gonna be able to get through? I'm feeling like I've been pushing for a while and I don't know if this is gonna so some of those like limiting beliefs or like blocks or those self-doubt fears started coming up during that phase. And again, it like loops all the way back to what we were talking about previously, like making sure you have that birth team and the birth environment that brings you back down into safety and like really believes in you and really wants to see this happen for you is going to help in those moments too. But even to your point of like preparing for that piece, like I actually don't know if I prepared for that, but when it happened, I was like aware of it at least, but almost preparing for it in talking to your provider of like, these are moments that I might need more encouragement or might need more support, validation that things are going right and are just going as they should be. I'm sure like that conversation is probably also, like, really healing and helpful to have too.
Oh, 100%. My doula knew, like, from my baby previous birth experience that pushing is where I'm gonna need the most support. And I took a program called Hypno Babies to prepare for going unmedicated and all of that. And during labor, I was so annoyed by, like, my headphones and, like, listening to the tracks, and I had just practiced so much that I didn't wanna listen to them. But when I started pushing and my doula had said, like, "Your baby's coming down and going back up," and that's what happened my first, and I was like, "Are you freaking kidding me?" And then she suggested, "How about we start listening to your pushing track?" And that made all the difference. Just her suggestion of, like, that extra support, and changing pushing positions, really, really helped. And I only pushed for 15 minutes, my VBAC, but, like, the first, like, 2 minutes of pushing, she was, like, saying the baby's coming down and going back up, and I knew right away, like, I need more support right now because that's not okay with me.
And the power of having a doula that could recognize that and, like, jump
Yes.
right in and support you too, like, that is literally the power of having a doula that knows how to immediately jump in and support you, whether it's, like, physically, emotionally, environmentally, that's, like, the art of having a doula too. And we didn't even really talk about this, but, like, will you just recap what a doula is? Because I think it's also confusing for first-time parents of, like, "Do I really need a doula? Well, I have my husband." Right? So, like, why is a doula so important? Not to mention all of the risks it reduces with so many other things and reports of moms feeling so much more empowered and educated throughout the process. But yeah, like, what is a doula and why should a mom have one in her birth process?
Yeah, so if I would have known what a doula was the first time around, I would have had one. So a doula is a person that can support you physically, emotionally, mentally, informationally throughout the entire pregnancy and birth and even postpartum process. There are so many different types of doulas, but we're talking about birth doulas here. They generally provide you support and education through your entire pregnancy. Some people don't hire doulas until, like, a couple months before giving birth. In my area, they book up really fast, so as soon as I peed on a stick, I hired one. Um, but they are there to really just be that extra support person, not just for you, but for your partner as well. They don't replace your partner. Um, they support your partner in doing comfort measures, mental and emotional support and preparation, and really just works as one whole team. But another big thing, especially in VBAC, is advocacy. Doulas are there to help support your birth plan, support your communication between you and your provider, making sure that you understand what is happening in the moment. One of the biggest causes of birth trauma is not understanding what is happening to you and feeling like things are being done to you, with you as part of the process. So doulas can really help alleviate and kind of facilitate advocacy as well. When it comes to VBAC, especially, what I like to remind people, a lot of people don't hire doulas because they think if I just end up in another C-section, like, that's a waste of money. But I wish I would have had a doula there for my C-section. They can provide not just mental and emotional support throughout the process, but say your partner needs to go with your baby, the doula can stay with you. They can help you get skin to skin in the OR, make sure that you are just supported in every way possible, take pictures, take videos. It's just an extra person there to offer all the support you could even think of.
Yeah, I wish I had one for my first birth as well. It's like one of my biggest, like, quote unquote regrets, if you will, for my second planning for a VBAC. I was like, definitely having a doula on board is crucial and important. Thanks for recapping all of that too, because I think it can be, especially you don't know what you don't know when you're a first time parent preparing for birth. And it's so easy to just like, well, we just need to keep expenses low and let's just save the money. And it's like, oh my gosh, like, birth will transform you inside and out. And like having a supportive partner, they're a doula that really understands the birth process. They're not only helping you in labor, but like most doulas also do some early stuff too, like some visits leading up to labor.
Mhm.
And then in the labor process, if you choose to have them there, and then postpartum too, there's so many options for doulas to have support before, during, and after labor.
Yeah, there was actually a study recently done that showed even someone consulting, like, 2 or 3 times with a virtual doula decreased C-section rates.
Wow, virtually. You
Virtually,
don't
even just, like, consulting a few times, like, yep, getting that information, they're so beneficial. Just having that informational piece can be so important too.
Oh my gosh. Well, this seems like a perfect segue to how do people get to know you a little bit more? How can they learn from you? And also, do you work with clients virtually? Yeah, give us all of the deets on where to find you and how to work with you.
Yeah, so my website is thehannahgill.com, and then I also have a podcast called the Motherhood Flow Podcast, all about VBAC tips and preparation. And then as far as like working with me, I do support only virtually currently. I used to support in-person clients, but I also work full time and that just became a little too much. So I have a VBAC preparation course called VBAC is Your Birthright, and that is for parents. And then I also train doulas on supporting VBAC and cesarean clients as well. So
Are so amazing. So if you are a doula and you want to be more, even educated more to support and specialize with VBAC clients, Hannah's going to be your girl to help support doulas. Not only that virtual support too, like reducing the risk of cesarean just by 3 virtual visits. That is absolutely huge. So that's amazing. Thank you so much for being here, Hannah, and sharing your heart and your wisdom. Any last final tips that you didn't get to share that you really want to share with our mamas?
I think the biggest thing is that just knowing and being aware that VBAC is an option for you. Like I said, I still is just so shocked by how many people don't even understand that VBAC is an option for them and go on to have 5, 6, 7 repeat C-sections because they aren't even aware that it's an option. So just anyone out there, if you hear this and you're watching this, like just spread awareness that VBAC is an option for people. Even if it's not something that you're looking into, like spread it, the awareness as far and wide as you can.
Yes, moms, talk to each other, grassroots marketing. We can do this. This is absolutely where we create transformation and change for mothers. That's really why What About Mom even started, is getting moms to speak up, advocate, share, and continue to spread the good word. So thanks so much, Hannah.
Thank you.